Before I get started, I'd like to thank Dr. Chan for the research opportunity that incorporates both my interests in anthropology and sociology. Today, I'll be discussing how blaming race and genetics on health disparities can lead to an unfair healthcare system. What are health disparities? Health disparities are differences in healthcare services amongst different racial and ethnic groups. Living in the U.S., health disparities have become a common topic of concern as we see a gap between healthcare services provided to the minority and the majority. Today, we will look at how genetics and race tie into health disparities and the overall effects on our society. When looking into the past, it is easy to see that racial stereotyping and grouping was a common habit among many. An open invitation to biological anthropology, we see this in Carl Linnaeus' work and his 4 categories of race and inherent behaviors. According to him, all African Americans were black-skinned and ruled by erotic nature. Native Americans are red in skin tone and ruled by habit. Asians are yellow or brown-skinned and ruled by belief, and Europeans are white and regulated by custom. These concepts of racial grouping have now led to many negative effects for many people in our healthcare system. As I researched and identified these early forms of discrimination, I felt the need to dig a little deeper and figure out how our society has created racial categories that now affect our healthcare system. Health disparities have many negative effects such as lack of accessible healthcare, late testing, misdiagnosis, and medical biases. The role of race in health disparities. Race is a cultural construct that has grown from the early studies of human diversity. This has led to racism, the belief that some races are inherently superior to others. Society uses race to explain health disparities because we believe there are some races who inherently have worse health, but there's more to the picture. There are socioeconomic statuses that affect people's health care, and we see more people of color having worse health care and experiences because of their race. Clearly stated, people with a lower social class have higher rates of illness. It is not that people of color have worse health, it is that people of color have been marginalized. And Enough to Make You Sick by Helene Epstein, she stresses that there is very little evidence that poor blacks or Hispanics are genetically predisposed to the vast majority of afflictions from which they disproportionately suffer. Epstein is able to follow a few families to hear their stories on how they and many others they know have poor health. It is immediately clear that poor urban areas cause many diseases, some having higher rates of mortality caused by chronic disease, and she shares that most illnesses in rural areas are not caused by one's genetics. It is caused by bad air quality, crowding, poor nutrition, and bad working and housing conditions. Epstein then goes on to explain how one's economic status really affects their health. She puts them in 2 reasons. 1, the weathering, grinding everyday stress of being poor and marginalized in the U.S. And 2, actual deprivation. When looking at Epstein and many others' work, it is easy to conclude that it is not one's race that is to blame for their health, but it is their lifestyle which in the end is caused by social structures that do not allow for a better way of living for many. But as in a society, we excuse health disparities with race because that is something that cannot be changed or controlled. The role of genetics in health disparities. One way I can explain the role of genetics is as a scapegoat for health disparities. Through my research, I have discovered that there is no genetic data to explain health disparities. Society uses genetics as a way to block political ramifications and remove the blame from the public. Majority of health disparities are due to social, behavioral, and environmental components. The focus on genetics as a cause to health disparities allow for stereotyping and ignore important information on how to decrease health disparities. To further emphasize the unnecessary use of genetics in health disparity studies is that human beings share 99.9% of the same DNA, which then limits the ability of using genetics as an excuse for the effects on health disparities. In Genetic Research in Health Disparities, Pamela Sonkar and many more explain the overemphasis on genetics as a major explanatory factor in health disparities could lead researchers to miss factors that contribute to disparities more substantially and may also reinforce racial stereotyping, which may contribute to disparities in the first place. Arguments that promote genetic research as a way to help alleviate health disparities are augmented by several factors, including research funding, initiatives, and the distinct demographic patterns of health disparities in the United States. How we see it today. While it is hard to ignore the current global climate as we see the lasting effects of COVID-19, it is also hard to ignore the many flaws that are being revealed in our healthcare system. To this day, we still see an unequal spread of healthcare access and coverage. Even now, when testing is accessible, not everyone is having equal service, specifically people of color. Health disparities during COVID highlight important patterns of inequity and racial inequalities. In a report by The Guardian, they share that Black residents make up 30% of Chicago's population, yet they account for 60% of its COVID fatalities. They also have the highest rate of infection statewide, making up a quarter of Illinois' total confirmed coronavirus cases, while only representing just 15% of its population. This disproportionate spread of COVID-19 reflects important patterns of inequality. Specifically, minority communities have a high likelihood of contracting the virus by living in urban areas and disproportionately working in higher risk environments. The real reason we see health disparities. When we see one specific race going through similar health concerns, it really has little to do with one's race or genetics and more to do with how society has limited their life chances. Without becoming too specific in our flawed social structures, the following express reasons beyond one's race and genetics that truly affect their health. Environmental racism, lower paying jobs, inadequate health insurance, medical biases, unstable living conditions, and simply lower socioeconomic status. From what I have gathered through my research, I think of it as a domino effect. Areas with more poverty have less funding for schools, leading to worse education, leading to jobs with less benefits and worse environments. Living in areas that may cause diseases with inadequate housing, which could lead to chronic illnesses such as asthma. And while trying to solve those chronic illnesses, they may face worse healthcare providers as they have less of an income and less benefits. In these healthcare provided services, they may face racism and doctors who do not get to the root of the problem because of racial biases. In a TED Talk, Rishi Manchada discusses a different way of looking at healthcare, the upstreamist approach. It is a simple solution. Doctors need to ask the right questions and know the community. He goes on to explain a story about Veronica from South Central LA. By asking the right questions, Dr. Manchada was one of the few doctors who pointed out her chronic illnesses, but more importantly, he pointed out the cause of the illness, which started at home. He provided treatment plans that went beyond the doctor's office with a community healthcare worker and public interest lawyer that would help improve her living situation that included roaches, water leak, and mold. Veronica later explained her symptoms improved by 90% and her son was no longer dealing with asthma. This further goes to show that it is not one's race or genetics that lead to chronic illnesses or any more diseases. It is the way that our social structures are set up for them and how they have to live their lives to survive in our society. Through my research, I have concluded that as a society, the emphasis of race and genetics as a leading cause of health disparities blurs the real issues with our healthcare system. In many cases, race and genetics will be to blame for health disparities, as that is nothing society can take responsibility for. With no responsibility taken, we see no change. Joe C. Phelan and Bruce G. Link better explain why we should not push the blame on race and genetics for health disparities with the fundamental cause theory. The theory argues that even though common diseases and their causes may change over time and place, in each situation, those with greater access to resources will experience better health, as there is a strong link between social class and health. An insightful solution came from combating racial health disparities through medical education. Deborah Blahnik shares that we need to receive more perspectives in medical schools, for instance from anthropologists, sociologists, historians of race, and human population geneticists. This multifaceted approach to healthcare will improve diagnosis and treatment plans for diverse populations and promote change. When thinking about health disparities, the question is not how we can improve health amongst a certain race, but how we can provide a fair social structure that provides a generous healthcare system to all, as there is far more to blame for health disparities than genetics and race. And these issues lie deep within our social structures. Thank you for your time, and I hope you enjoyed my presentation.